is Patrick Long. Welcome to your Catapult Benefit Minute. Today's topic, top 10 costs. So this is part 3 in our series, Where Does Our Money Go? We're going to break it down for you. Today's topic, primary care, right? Primary care, very important, but often misunderstood. Let's talk about why. It only consumes about 10% of your plan dollars, which is very expensive, but it drives 50% of your plan spend. How does it do that? Primary care doctors often act as the quarterback of care or the continuum of care. What do I mean by that? They're making referrals to imaging, surgeries, specialists, pharmacies, and all the rest. So primary care doctors are driving or steering your patients, your members, to care that might be more expensive and not a better value. So inside this 10%, however, includes things like annual checkups, blood tests, x-rays, women's health, flu shots, vaccines, and all the rest. But what's really important, that's very important, but what's really important is what do they do for prescriptions and referrals? Because that's really going to drive the performance of your plan. Let's look at your options. So if you're in a status quo PPO, like most of you are, and that means you have a Blue, United, Cigna, Aetna plan, you probably have copays for primary care, telehealth. You may not even offer behavioral health. If you do, it has a copay. I'm asking you to rethink that. Zero primary care, zero telehealth, zero behavioral health is going to be much better ROI for your bottom line and much better benefit for your members. How is that? Just think about it this way. One trip to the ER could cost your plan $3,000, and that's going to buy 1,000 months of free telehealth for your employees. So just think about that. That's an incredible ROI right there. PCPs and DPCs, what does this mean? These are the types of doctors that are on your plan. So a status quo PPO like yours, you have primary care physicians, perfectly good doctors. They work, however, for the hospital. The hospital's buying up, these big systems are buying up primary care doctors all around your area and making them referral agents for their hospital. MRIs for $3,000, $4,000, surgeries for 3 times the price. The primary care doctors get penalized if they don't refer to the hospital system. So they're kind of handcuffed by that. But it gets worse. Did you know that primary care physicians in your network have on average over 2,000 patients on their panel? That's how many patients they see. I'm one of those. I'm switching. My doctor doesn't know me. The average time that they spend with their patients is less than 10 minutes. One recent study said 7 minutes is the average face time with a primary care doctor that works for a hospital. Again, perfectly good doctors, but they're time constrained by having to see 2,000 patients and enter data endlessly into EHRs. So they're not even looking at you, they're entering data most of the time. Conversely, direct primary care doctors, they're owners of their own business. They're local community owners, right? They have an average of 500 patients on their panel. They get to know their patients. They spend an average of 40 minutes with their patients. It doesn't take a month to get a visit. They can see you same day or next day. So very different ways to approach primary care. They refer to the highest quality and lowest cost, not into the hospital system. So that's the difference between status quo and hero with primary care. That's how insurance works. Thanks for watching.